My name is Dana Bozzato, and I'm the Executive Director at the Huron Perth Centre for Children and Youth. I think my journey into mental health and social work began when I was working one summer in a local secondary school in a teen program, and while I was there I got to witness the educators, guidance counselors supporting youth who were trying to find their way, trying to figure out a career path or what really interested them. And I got to be part of that program that summer, supporting students. And I left that work experience feeling pretty sure that I wanted to do something. I wanted to do some work with kids in the future, and in a field that allowed me to help kids figure out things. So solve some problems maybe, or figure out a career path. I wasn't really sure what that was going to look like, but that was the work that I was most interested in. Our mandate is to support children and youth up to the age of 18. That's our mandate. We're funded by the Ministry of Health and Ministry of Children, Community and Social Services to support child and youth mental health. We also work with caregivers and parents. So while the youth might be the focus or the concern, and we work directly with youth, we also work with their family members and extended family members and the community as well. But our focus is up to the age of 18. So really looking at early years mental health, so those really important first 3 years, first 6 years, and then supporting the development and well-being of children and youth, looking at family relationships, looking at the quality of those relationships in the home, engaging with families and parents and caregivers to enhance those relationships as well. That works pretty central to how we think about child and youth mental health. That really, child and youth mental health, it grows and develops within the context, first and foremost of the family, and then within the larger community. Generally speaking, exercise and diet and good sleep, and being really, not really social, but being social, having kind of a network of supports or friends or people that you can kind of call on or rely on is really important as well. And again, that kind of the mix of what works for one person might be different than it would be for other people, but it's, I think, really important for people to really get a sense of what works for them and pay attention to that, what restores that energy balance. I think that that's pretty key to mental health and well-being. I think it's really important, I think, to celebrate the connections and the collaborations and the partnerships that we have in Huron Perth. When I think about Mike Unger's work on resilience and the importance of building the network of support around children, youth, and families, we are that network of support. Individual agencies are part of that network of support, and I think we do that really well in Huron Perth in terms of our ability to collaborate and partner and work together. Coming together around a campaign, a media campaign for Mental Health Week, I think is one example. But every day I spend time connecting with a community partner about a client or about a service or about program planning or maybe new funding. We might spend some time reviewing where we've been over the last year, or looking at a current service that we provide, or look to the future. And all of our planning at Huron Perth Centre is done. The service planning for core services is done with our ministry partners, but also we look to our community partners to support that work as well. I would like to see it to be easier for people to talk about their mental health and their well-being, as easy as it is for people to talk about their physical health. Generally that it's easier for us to say I have a doctor's appointment than it is to say I have a counselor appointment. So to find our way to that place where it's okay to talk about mental health, it's okay to talk about when we're doing well or when we're struggling. It's okay to talk about the resources that are available in the community and that we might reach out to those resources when we need to. It's okay to ask for help. And it's okay to not be okay. That's okay. It's kind of a part of growth and development that we may have times where our mental health is impacted by what's happening in the world, what's happening in our personal lives, and that's to be expected. And it's okay to reach out for some support if you need that support. I think there are lots of resources in the community that are available. I think looking to 211 as a first stop that opens up the avenue for lots of different resources, and then you can speak to somebody who could help you figure out which resource might be the most beneficial to you. We have mental health resources and supports in the community that are available to adults, that are available to children and youth. We have mental health supports that are available within schools, within family health teams as well. So there are lots of resources actually that are available in the community that are through what I call the funded system. So Ministry of Health funded or Ontario Health funded or Ministry of Children, Community and Social Service funded. So that means no fee for families to access. And I think it's important that people in the community know about those resources. There are private resources as well that people can access, but it's important for people to be aware of the funded supports that might be hospital-based or might be community-based. But there are lots of resources available, and it might be hard to find them right away. Again, 211 is an option to consider as you begin your exploration, or speaking to a family physician or somebody through your school if you're worried about your child. But it's important for people, I think, to know that there are lots of resources available, and we're working really hard as a community to make it easier to determine where those resources are and make it easier for families, children, youth, and families and adults to be able to access them.